What's the cleanest way to distinguish orthosteric from allosteric behavior early without structural data?
Great question. Very good question. Very important. I'll start off by saying there are certain ways that are low effort, but they're one-way experiments. If you have an allosteric compound, it could show its hand with these and you're home free. However, a NAM with a very small alpha value can produce a large number of shifts, 100-fold, 1,000-fold shifts with no depressed maximum. It can really look like an orthosteric competitive antagonist. So that's why I say it's one way. But the best way is to demonstrate saturation, because unlike orthosterics that compete, there, if you have varying quantities of each ligand and keep adding, you can compete forever in theory and show huge shifts, 10-fold, 100-fold, 1,000-fold, and so forth. An allosteric effect stops when the allosteric site is full. So if you have something like a NAM with an alpha of 0.1, it's going to produce a 10-fold shift, and that is all it'll do. That's it. You can add as much as you want. You'll never get more. So that's a clear hallmark of an allosteric. Good way is to determine a Schild plot. And I'm talking now of an antagonist. Obviously, if you have a PAM, the only way that can happen is allostery, so you're home free there. So we're talking about orthosteric and allosteric antagonists. Do a Schild plot, and as the compound produces shifts to the right, as you hit the end of your allosteric occupancy, the Schild plot will curve and the slope will get less than 1. So you see a curved Schild plot, you know you have an allosteric. The other thing is allostery is probe dependent. Different agonists may give you different amounts of shifts. So you can have a NAM and you use agonist 1 and you get a maximal 30-fold shift. You try a different agonist and you may see a maximal shift of only 6-fold. That's a hallmark of an allosteric. So all those are clear ways, quick ways to show an allosteric. However, if you've got an allosteric molecule with a very, very small cooperativity factor, alpha's like 0.0001, then it can give you a straight Schild plot with a slope of 1 over a large concentration range, and so you're still stuck. You can't differentiate between an orthosteric or an allosteric. So I'm coming to the end of my answer here. The surest way, and if you're ever going to publish that you have an allosteric compound, editors and reviewers are going to ask you to demonstrate effects on kinetics. Only an allosteric molecule can change the onset and offset kinetics of an agonist. Orthosterics cannot. So it's a bit more work, but you have to show that you alter either the offset or the onset of an agonist with your inhibitor. And if you do, that's evidence that you have an allosteric. So that's the long answer.